Right.
Can record and live YouTube, yeah? Okay.
Good afternoon and welcome to the report launching and public discussion commemorating 2 years into pandemic, with 2 reports being launched on the topic of advocating health protection and eliminating excessive placement and recruitment fees of migrant workers in Southeast and East Asia. This event is being organized by Human Rights Working Group, Sasakawa Peace Foundation, and BBC. BBC stands for Better Engagement Between East and Southeast Asia. It's an online movement building initiative to exchange information and resources, as well as discussions on the rights of migrants and their families across East and Southeast Asia. To commemorate 2 years after WHO declared the pandemic, BBC has developed 2 initial reports on migrant workers' health protection and placement fees in East and Southeast Asia. To launch and further discuss the findings, policy dialogue is necessary in order to disseminate and exchange ideas in these cross-cutting human rights issues for migrant workers. In this occasion, we are really privileged to have amazing speakers here participating with us. So to start off, we're going to be hearing the welcoming remark from Mr. Itsuo Adachi, the Executive Director of the Sasakawa Peace Foundation. Mr. Itsuo Adachi, the screen is yours.
Thank you very much for your introduction. So, distinguished guests, ladies and gentlemen, good afternoon. My name is Adachi, Executive Director of the Sasakawa Peace Foundation, Japan. It's my great pleasure to warmly welcome you to this report launching and policy discussion entitled 2 Years After Pandemic, Advocating Health Protection and Eliminating Excessive Placement and Recruitment Fees of Migrant Workers in East and Southeast Asia. First of all, I'd like to express my congratulations to the authors of the 2 reports, Mr. Adeline Tinesia from University of Sydney, Mr. Pamungas Ayudaning from BU, Amsterdam, and members of BBC team on your efforts to come up with such a comprehensive and informative reports. Please allow me to express my honor to have partnership with your team. The Secretariat of BBC, which is hosted by Human Rights Working Group, led by Muhammad Hafiz, and Mr. Lafendi Jamin, and Mr. Daniel Awigula. Our foundation has been a partnership with Human Rights Working Group for years. May I tender their trust with us and their professional and dedicated works. Let me also express my sincere gratitude to the discussants today, Dr. Chabambao from Sacha Wakana Salatiga University in Indonesia, Ms. Joanna Concepcion from Migrant International, Ms. Reiko Harima from Mekong Migration Network, Mr. Fajal Santoadi from Tenaga Nita, and Mr. Sabinaya Divya Mohan as a facilitator. At the title of this event, 2 years have passed since World Health Organization declared the COVID-19 pandemic. Starting from this March, Japan eased entry restriction for foreign students, business travelers, and other non-tourists. This could be good news for sending countries and migrant workers themselves. Though Japan will accept many foreigners again, the reality is many of migrant workers are non-regular workers. We should not forget that under the COVID-19 pandemic, migrant workers have been forcibly placed in an institutionally and structurally vulnerable situation such that they are deprived of social protection, including health. The terms of the reports, health protection and placement fees, directly linked to the lives of the migrant. The research results and recommendations from the reports will enlighten us how to should change the society that everyone, including migrants, can enjoy their basic human rights. Since the year 2008, the Sasakawa Peace Foundation has been working on international migration across Asia, including Japan. SPF conducted empirical research, multi-sector roundtable meetings, and delivering policy proposals, awareness-raising activities in this area. Throughout the process, SPF has been engaging with multi-stakeholders and serving as facilitator to connect among experts, practitioners, central and local governments, and business corporations. SPF is about to start a new project that envisions developing a model of self-help and mutual help among migrants and multi-stakeholders from business, civil society, education, and academia sectors in Japan. The process and findings of the project will be widely shared with broader stakeholders, including the government. It is expected the model will be applied in Japan and Asia and contribute to realize inclusive and diverse society. The unprecedented crisis brought by the pandemic could be an opportunity for changing the society. I'd like to believe that Asia has a potential to overcome this crisis by strengthening its robust social capital and networks, while respecting diversity and inclusiveness and helping each other. And also believe that the problems associated with an international migration will be improved through wisdoms and joint endeavor with stakeholders across the region. The Sasakawa Peace Foundation will do its utmost to contribute to the improvement of migration programs in Asian countries, and at the same time, they consider the responsibilities of Japan as an emerging destination country. I hope that today's policy discussion will stimulate the issues and solutions in Southeast Asia and East Asia. Thank you very much for your attention.
Thank you very much, Mr. Adachi, for the very warm and insightful welcoming remarks. Now, before we move into the report launching, we're going to have a short photo session. So for all speakers and the Secretariat of HRWG and SPF, feel free to turn on your cameras to join the session. Is everyone ready? Okay, I will count down. 3, 2, 1. One more time. 3, 2, 1. Yep. Thank you very much. Now it's time to move into the next session, which is the report launching. So I'll be handing over the event to our facilitator today, Ms. Abhinaya Divya Mohan, the head of campaign at Women's Aid Organization, or WHO Malaysia. Ms. Abhinaya, the screen is yours.
Thank you so much, Aoife. Hi, everyone. I'm very excited to be here today, and it's such an honor to be facilitating this session with an amazing panel. And also thank you to the Human Rights Working Group and Sasakawa Peace Foundation, as well as BBC, for hosting this report launch and what I'm certain will be an illuminating discussion to follow. The two reports that are being launched at a very crucial time, as you know, tomorrow marks exactly 2 years since the World Health Organization declared a pandemic. And it's also in time for the celebration of International Women's Day and Women's History Month, because gender must always be a crucial consideration and element of all research on migrant worker experiences. Now, as we all know, we are still in the midst of a pandemic. Otherwise, we'd probably be meeting in person and having this discussion session in person. And the works presented here today will touch upon the impact that COVID-19 has had on migrant labor and their human rights in the region, as well as East Asia. I would like to start by first sharing the flow of today's event. We have with us two stellar researchers, Adeline Tunisia and Pamungkas Ayudaning Dewanto, or Yuda, if I may call you that, who over the next half an hour will share with us research findings and recommendations from their respective studies. So you have 15 minutes each. Then for the hour after that, we will move on to a very exciting policy discussion that will reflect upon these findings, as well as the lived realities of migrant workers and the experiences and research of the discussants here today bring us. And the discussants today also work very closely with migrant workers themselves. Our esteemed speakers joining us for this discussion are Charan Esbal, Joanna Concepcion, Reiko Harima, and Fajar Santowadi. Finally, we will open up for a question and answer session, which will be about 30 minutes, so that we can hear from all of you who are present here today. I'm sure you'll have many burning questions. Now, I don't wish to keep you waiting any longer, so let me introduce our first presenter, Adeline Tunisia, who will be sharing findings from her report commissioned by BBC, titled Strengthening Health Protection for Migrant Workers in East and Southeast Asia. Adeline is a graduate student at the University of Sydney, currently pursuing a Master's of Global Health. She's interested in the intersection of health systems with human rights and migration, and has previously worked on projects surrounding COVID-19 and migrants, HIV, AIDS, and human rights, refugee rights, as well as women's rights. Adeline, please take the floor.
Thank you so much, Abinail. Just try to share my screen. Is that sharing at the moment? Yes, okay. Again, thank you so much to HRWG, SBF, and BBC for having me to present the report that I've been working on in the past half a year or so, looking at strengthening health protection for migrant workers in East and Southeast Asia. So this is an extremely important topic and extremely timely topic because obviously the pandemic has shown how important health is, but also because migration is a social determinant of health, which means that one's healthcare is affected by the migration process because migrants can face obstacles in accessing healthcare in both sending and receiving countries. As a result of irregularity, immigration status, language and cultural barriers, financial difficulties, among others. But it's undeniable that migrant workers have made considerable economic and other contribution to the sending and receiving countries. And despite this fact, their right to health is not respected and are often left behind and unaccounted for in health systems. This is despite the fact that many migrant workers actually play a very crucial role in healthcare settings as health professionals and care workers. The migratory process highlights the need for transnational health protection as the circumstances of migrant workers leave them out of sync with the territorialized and sedentary welfare provisions in sending and receiving countries. Because migrant workers' positions often being in between socially and legally of the overall institutional welfare arrangement, and specifically the health protection system of receiving and sending countries, their health needs are often partially or entirely unmet. And this has an immediate effect, particularly when their core health needs are not being attended to. Importantly, the ramifications of unmet health needs are not merely those that are immediate, but also long-term impacts on the lives of migrant workers. Another issue is about portability of health protection. So will the contribution that migrant workers have made to the social protection systems in either home or receiving countries be acknowledged during their transitions? The lack of portability and long-term benefits in country of destination can affect migrants' decision to contribute formally. And at the same time, the lack of portability of acquired rights can affect the decision to return home. And as I said, the pandemic has really highlighted inequalities within societies and across the world in a number of states, as migrant workers have disproportionately suffered the brunt of COVID-19 infections. Cases of COVID-19 spreading across migrant dormitory, housing, or detention centers has been noted across multiple countries. And the economic downturn experienced as a result of lockdown measures and travel restriction rendered a large number of migrant workers without work, affecting their migratory status and dramatic reduction in remittances. The economic impact that is experienced will ultimately also have a health impact. So, there's a need to understand better how migrants within East and Southeast Asia are either accessing or not accessing health system to better advocate for migrants in the region. So this research studied health system and legislation in several sending and receiving countries. And importantly, it analyzed the experience of losses and gains in health rights during the migration process for migrant workers by looking at existing health protection coverage in these countries, mechanisms for health protection that are being implemented, political, social, and economic benefit of affording health protection for migrant workers, informal social protection systems developed, and how COVID-19 has created changes in healthcare provisions. And this was done through a desk review as well as focus group discussions. Obviously, in an ideal world, a interview process would happen, but with COVID-19 restrictions and everything along with that, it sort of have made it a bit difficult. So, but I'm hoping that this report will serve as a basis for any future research that can be conducted. But before I want to continue, I thought it'd be good to go through a couple of concepts and definitions that are important to the understanding of this report. And the first is universal social protection, which is to reduce vulnerabilities and economic risk of individuals and communities. It seeks to prevent and reduce poverty by promoting social inclusion and the dignity of vulnerable population. It aims to contribute to economic growth by raising incomes and increasing consumption, investment, and domestic demand. And health is an important aspect of all human beings and is integral to the running of society. So it's an important part of social protection to ensure that individuals are afforded good health without discrimination of any kind, be that identity or financial or otherwise, to guarantee their continued contribution in society. And universal healthcare refers to comprehensive, appropriate, quality health services provided to the people. And this means all people having access to health service and when and where it's needed without financial hardship. So UHC, in its purest definition, is integral in the context of migrant workers, undocumented peoples, and overall non-citizens' health rights, because UHC in its purest form should encompass all of them. And this is important because ultimately this health policy has a very tangible impact on the livelihoods of the people we are talking about, of migrant workers, right? Because it's so tangible, because it has a very direct impact, it's ever more important that we discuss it. My report looked at three migration corridors. The first one is Indonesian migrants going to Malaysia and Singapore. A theme in the experience of migrant workers is actually the separation of healthcare from which the citizens of the destination countries are able to access. That even after COVID-19, there continues to be a separation of facilities that migrant workers can access, all the rules and regulations that govern them. So for example, while Singapore responded to the growing cluster of COVID-19 migrant dormitories, the policy that they chose to take for migrant workers is not the same as those of citizens. There's a segregation in facilities and the restrictions that are imposed on them. And what the advent of COVID-19 has shown is that the segregation of policies between migrant workers and citizens, residents, is a poor decision, not only on the part of human rights, but also on the part of health security. That is, without ease of access to the health system, migrant workers will remain vulnerable population to disease because of their inability to access healthcare due to cost or fear or deportation or fear of losing work, among others. And this is in addition to deal with diseases at a speed that is necessary to stop its spread. Undocumented migrants not only are unable to access healthcare, they also run the risk of being reported and deported in both Singapore and Malaysia. And both countries, there are language and cultural practices or customs regarding healthcare that should be addressed by outreach and education because it impacts the quality of healthcare that migrant workers are afforded. Healthcare seeking behavior may be delayed or discouraged, among other things, as a result of a lack of sensitivity or internalization of exclusionary arguments. So for Indonesian migrants workers who work in Singapore and Malaysia, the process of migration itself at the moment means that they're losing health rights, despite the fact that Indonesia's health infrastructure is poorer than that of Malaysia and Singapore. In terms of internationally, whilst Indonesia, Malaysia, and Singapore are ASEAN member states, they have more opportunities available to discuss and put in place collaboration and cooperation. The countries still need to explore avenues that are more legally binding. And this is particularly with Indonesia's shift in affording all their citizens UHC, and therefore they're more aligned to the health system of Malaysia and Singapore. So there's future opportunities there. In Vietnam and Japan, considering Vietnam's comprehensive coverage for its citizens, health coverage that is, it's obvious that in the process of migrating to Japan, Vietnamese migrant workers lose health rights as a result. And this is interesting because Japan's health system are touted positively for its quality of service and access, but it's not the case for migrants who are trying to access these health services because of gaps in eligibilities and accessibility. Language barrier when accessing healthcare is a prominent issue for migrant workers. And it's also clear that while Japanese government has set a number of standards for employers to follow with regards to working conditions, there are huge gaps between implementation. So compliance issue with regards to safety standard is a problem and it's a risk to the health of migrant workers whilst they work in Japan. The profound mental health impacts of migration, as well as the added stress of working and living conditions in Japan, means that there's a great need for mental health support, for migrant-focused support programs, and transcultural training for employers, for health workers, as a form of health promotion. And lastly, improving the health rights of Vietnamese migrant workers in Japan requires changes beyond the health system. The government must actively work towards improving living and working conditions because the environment that migrant workers are exposed to are associated with poor health outcomes. Interestingly, in the case of Cambodian migrant workers migrating to Thailand, it's a little bit of the opposite experience. That is, in the process of migration, it leads to the gains of health rights for many Cambodian migrant workers. And that's because Thailand's UHC system is somewhat inclusionary towards both documented and undocumented migrants. So when Cambodian migrant workers migrate, theoretically, on paper, they are afforded more health protection at a higher quality than back home. So there is issue that when Cambodian migrant workers return home, they lose health rights that they gained during their employment in Thailand. Thailand and Cambodia have also shown more initiative and progress with regards to bilateral route and discussion to improve health of migrants in the countries. So they've worked towards an MOU to develop border health services or a proposal to build sister hospitals along the border. And as with other cases, improving cultural and linguistic competency in health services is still necessary. And Thailand is by far more inclusive in its provision of healthcare and health protection for migrant workers in comparison to other case studies. But that being said, some improvements should still be made. For example, Thailand is home to very many informal migrant workers who often fall in the gap of the health protection schemes. So a better system must be developed where subsidized health coverage is not optional for informal workers, but it should be mandated by the employers who hire undocumented workers to afford their health coverage. So to try to kind of summarize all the common barriers, which is quite difficult, but the first and foremost is that migrant workers are often viewed as an economic commodity and only for their economic benefit and not for the needs that they have during their time working in receiving countries. And as a result, migrant workers are excluded from receiving countries' health system. There's persistent stigmatization of migrant workers within the public and within the health system itself, which affects the quality of healthcare that they are provided. Healthcare are often inaccessible and also poor, and this is partially as a result also of linguistic and cultural barriers. There's a lack of mental health care, and there's a lack of healthcare for women. And there are issues associated with undocumented workers who are often not afforded any type of health right at all. And there are poor access or differences in health care when returning home. So I've highlighted some of the issues, what needs to be changed. So when thinking about solution, it's important to think holistically about all the other social determinants that interlinks with health. So first and foremost, it's important to include migrant workers in local health system, that the provision of healthcare should not depend on employment status or contracts, that regardless of who you are, what nationality you are, you should be able to access very necessary healthcare. And also barriers to uptake of preventative health services is also necessary because this is important for the health outcome of migrant workers in the long run. Until that can take place, we need to ensure that employers implement protection policies that already exist. So monitoring capacity is really important to make sure that that employers are following their obligation in terms of providing their health, providing migrant workers health insurance, and this should be conducted by the government. Stigmatization needs to stop because it affects the access and quality of healthcare that are afforded to migrant workers, and also that the treatment that they receive by their employers and the wider public can have extensive implications for their mental health as well. Linguistic and cultural appropriate health services are extremely necessary. A lot of the issues in terms of accessibility to health services lies on language issues. So ensuring that translation services are available to all residents is a government responsibility. And for health workers to be trained in cultural diversity training to understand cultural differences and even just understanding policies, because there have been issues raised up during the research that health workers are unsure whether they are allowed to treat a migrant worker as their patient. Providing healthcare to undocumented worker is necessary, and even more so during a pandemic, because we can see that the COVID-19 does not discriminate, right? It affects everyone. And when there are gaps of people being able to either test, go to a health service, get checked for their health, then we are allowing diseases to transmit unknowingly. So this can be done through an amnesty period for migrant workers to be documented. Sorry, there's a typo there. But ultimately, that migratory status should not be a decision-making for healthcare access. Including mental and women's health in healthcare provision is extremely necessary, and it's systematically unincluded. And in the case of women's health, women are discriminated against in the sense that a lot of policies actually essentially ban women for allowing to exercise their rights. For example, in having a relationship and getting pregnant, they risk losing their job, they risk being deported. So this gap needs to be addressed for holistic healthcare. Systematically, bilateral and multilateral agreement will need to be continued to be pursued, and agreements between countries to establish reciprocity of health rights is important, and to leverage the fact that many countries are working towards the establishment of UHC. Cross-border system is important for health monitoring, for ease of transfer for health knowledge, and for the migrant workers to not lose their access to healthcare, and also medical history. And ultimately, there needs to be future research to connect existing information on rights issues with health outcomes empirically. And this research needs to be done intersectionally, and it has to be ethically sound, and it has to be with a human rights approach. Thank you so much. I hope I haven't taken too much of your time. I know I went overboard. It's hard to summarize everything, but yes, thank you so much, and looking forward to Yuda's presentation.
Thank you, Adeline. That was such a great presentation. I think a point that really stood out to me was the accounting for political, social, and economic benefits of migrant worker contributions. From my knowledge, this is lacking. I mean, research in this is lacking in several countries, including my own, or at least, there is no concentrated effort to take this information on board. And the other really important point is sort of the intersection between women's health, women's access to health and mental health care access, as well as linguistic and cultural barriers, because that's been an issue that's sort of exploded during COVID. Thank you so much for that. Now I invite Pamungkas Ayudaning Dewanto, or Yuda, who is a PhD candidate in social anthropology at Free University, Amsterdam, to present his report on understanding the pattern of placement and recruitment of migrant workers. Yuda's PhD thesis is centered around the emergence of Indonesian transnational migrant communities in Malaysia. He's also a research consultant in several institutes, working on the issues of recruitment and placement of Indonesian migrant workers. Go ahead, Yuda.
Thank you very much, Abhinaya. First of all, I'd like to congratulate SPF and HRWG and BEBESEA for successfully launching this important, I think, event, and also very good initiatives from the ground, yeah, from below. And yes, my part is I'll be covering about the excessive cost of placement and also fees associated with it. But before I start, please allow me to turn off my camera because I'm afraid the bandwidth in my place is a bit unstable now. So please allow me to do that. Thank you. Yes, so I have only 15 minutes, so I'll be just jump in and probably I'll be sprinting. So please let me know if I'm too quick, but I'm expecting to discuss about the research itself afterwards with the great panelists that are already present here. Yes. So yes, this research is basically what you will be expecting from my presentation. That I will be dividing into 5 parts: introduction, and I'll be taking a look at the practices on the ground about related to the fees and costs of migration. And then we're using the approach of migration infrastructure, which we will look at the actors that are involved. And then also we'll be looking a little bit about the multilateral frameworks and why do they stall actually in controlling the cost of migration. And finally, with the recommendation. Well, cost and fees associated with the placement of migrant workers are 2 highly discussed topics in the world of migration advocacy. This was because migrations basically increasingly become more complex as nation states governments have employed a flexible border regime that is in between limiting and facilitating mobility, people's mobility. Although the infrastructure to facilitate migration has become widely available, people do not necessarily migrate with ease. The more restrictive regulation of migration indicates that migration is not easily accessible to people, which causes migration to become more expensive. Having examined migration corridors, scholars, international aid agencies have all revealed that excessive fees and costs during recruitment has contributed to core problems of migrants' exploitation. Although we know that the practice of charging excessive fees and costs to migrants migrants is widespread practice in many regions, there has been little interest among the academia, migrant advocacy group to address them from a broader regional perspective. Well, to answer why costs and fees with regards to recruitment and placement are difficult to control, this report will firstly identify the common pattern of migration, placement of migrant workers in Southeast and East Asia by investigating the roots of costs as well as the migration cost structure. From there, this research will capture the pattern of recruitment of migrant workers in two regions by paying attention to the migration infrastructure. Next to answering the two questions, we also try to provide this must be done amidst the mobility restriction caused by the lockdowns. And there are many health protocols that we must undergo when traveling, so it's not possible. This study combines desk research and limited fieldwork conducted between July and October due to time constraint and mobility restriction. This report also draws on focus group discussion, as Aline has also mentioned, held in September 2021, involving about 15 resource persons representing both sending and receiving countries such as Taiwan, Indonesia, Malaysia, Thailand, Vietnam, Japan, and Hong Kong. And I've also conducted a limited interview with local labor agents, which I relied based on my past interview data when I did my fieldwork for my dissertation. Well, let me begin by highlighting the regimes of temporary migration in Southeast and East Asia. The migration of laborers in Southeast and East Asia is premised upon return. Return is a way to control and limit the hypermobility of people concerning Asia, where both nationalism and economic development conflict and create a unique development policy. By politically imposing return, thus maintaining temporary status, the state has expressed its role as guardian of sovereignty of the nation-state system. When embracing temporariness, countries maintain different expressions. In Japan, for instance, the Japanese government has been inviting workers under what it calls Technical Intern Training Program, or TITP, by coupling the temporary status with a novel goal of achieving the knowledge and technology transfer. Japan has actually secured the supply of mainly cheap labor to its industries. The situation in South Korea is not very much different, and the precondition for foreign workers' employment was indicative of the national demand for cheap labor. Global trend shows that countries ambivalently desire mobility and mobility, treating migration as an object of both industrial income and security concern at the same time. This has made migration a genuinely expensive activity because mobility is followed with many restrictions, making it more achievable using the service of facilitators who navigate against bureaucratic barriers, elements that are principally, but not logistically, independent from the migration itself. Temporary migration resulting from the mobile yet immobile migration regime of many governments has situated facilitators even more central in Southeast and East Asia. While the ILO has enacted the standard for recruitment, such as cost, fees, and charge, how each national law interprets recruitment fees and associated costs are both diverging and lacking in detail. In order to ostensibly obey the ILO standards, they often invent new terms, which is to be detached from the term recruitment and placement. For instance, among PRAs in Indonesia, they propose the term the cost for covering dokumen jati diri or personal identification documents, which is to be completed far before recruitment stage. Hence, they insisted that it should not be considered as part of recruitment costs. So there are diverging interpretation of what constitutes recruitment here. We also saw another case in Hong Kong. The government of Hong Kong has also enacted a law to limit the charging of recruitment fees by local labor agencies to a maximum 10% of the workers' monthly salary. Yet the findings from Hong Kong, the Federation of Asian Domestic Workers Union, suggest that workers are generally charged 25 times higher than the 10% charge from the worker's salary as stipulated by law. Well, in the following table, I tried to summarize documents and undeclared documents that are used to place migrant workers. You might find this a bit too small. Well, when I summarized this, basically I investigated documents for placement recruitments in 3 stages: the pre-recruitment stage, recruitment and application stage, and the departure stage. Well, to make it simple, let me just summarize this table as follows. So during the pre-departure stage, migrant workers will have to collect or obtain 12 documents from nearly 13 different institutions. As for the application stage, migrant workers will have to obtain 7 more documents from 7 different institutions, which are located in various locations. This indicates that internal mobility during this recruitment stage also significantly play a role. Lastly, for the departure, migrant workers will have to obtain 5 more documents or items from 4 different locations. So in total, migrants will collect about 24 documents or items or activities for them to successfully depart to destination countries. From general observation on the recruitment practice, now I move on to reviewing the role of actors in migration infrastructure. I will begin with governments. So although governments in Southeast and East Asia play an ambiguous role in promoting and restricting migration, the government remains the central actor controlling the flow of people's mobility. The politics and the economy of migration are conflating, thus have produced various national policies that express a balance between the two aspects. In the sending countries, the politics of migration regulation is often expressed through national policy. Due to the strong pressure from the CSO, for instance, the government has limited PRAs, private recruitment agencies, from administering recruitment. This is particularly the case in Indonesia, despite that the implementation is, of course, hardly applicable. And in the receiving countries like Malaysia, the government remains using regularization and voluntary deportation strategy, which aim is to let migrants pay for their own settling. And this increased the fiscal capacity of the government, of course, to taxation and levies, things like that. All these options have increased the potentiality of PRAs or facilitators to charge more fees to workers. Well, for the private sector, they are equally important to the labor recruitment as the government. With the provision of labor protection regimes, as demonstrated in many sending country governments and also in previous slide, the PRA is moved from peripheral to central when dealing with migration bureaucracy. Instead of diminishing, unfortunately, the role of PRA has become much stronger in the facilitation work because the human resources of the government are not enough to deal with applications from the job seekers. Therefore, the role of PRA has been elevating from just connecting job seekers and employers to mitigating the bureaucratic barriers or hassles. In addition to the bureaucracy of protection, recruitments also involve logistical problems, causing private actors to become central actors in the recruitment process. The core problem with logistics lay in the gap between people accessing jobs and the jobs themselves. Other than brokers, one determining actor among private actors is the loan provider, either the formal or informal ones. As the bureaucracy of migration increases, migration has become expensive and lowered people's capacity to migrate. A credit scheme, therefore, is there to mitigate the adverse effect of increasing bureaucracy. Yet instead of helping with financial capacity, this will bring more exploitation in the post-departure stage of migration. Now we're turning to civil society groups. Well, I must say that this section will be a bit biased to the Indonesian case because of the availability of the data. So basically beginning in 90s, migrant workers have been playing an important role shaping governance of migration. And this in emerging democracies such as Indonesia, CSOs have been strongly involved in the national policy making, although the government remains the dominant actor. CSOs have been openly critical when policies with regards to the recruitment of foreign laborers, for instance, were accommodative of private sector interests. However, the term CSO is also problematic here, in that it refers not only those embracing human rights values, but also to profit-oriented interest groups. In countries where migration facilitators can establish freely, the PRA has come to establish their association. These associations play an important role in lobbying, negotiating with the government, disciplining their informal recruiters, and also disseminating information. Associations' close partnership with the government often overshadow the advocacy networks of migrant workers CSO when coming to the policy-making process. And of course, part of the COVID-19, well, immobility caused by the pandemic has had a fundamental effect on the placement and recruitment of migrant workers. In many places, the placement of formal migrant workers during this period has decreased significantly. Mobility restrictions set by major, especially migrant receiving countries in East Asia, would likely trigger an adjustment in the placement process. This is because, I borrow Xiang Piao, The pandemic has produced a grid reaction or a decentralized reaction of various authorities in restricting traveling through documents following the attempts to isolate local citizens from the virus, the COVID-19. The pandemic, which halts the operation of many PRAs, has provided unofficial brokers to gain momentum for conducting trial and error with their clandestine migration channels. Meanwhile, the Indonesian PRAs are also pushing the government to criminalize informal brokers, not only under trafficking in persons law, for instance, but also under the National Criminal Code or Hukum Pidana. The attempts of the PRA to regain control over migration will have a significant impact on the costs and fees of migration. Well, now I move on to the multilateral frameworks by mainly asking why are they not successful? Here, we focus on two leading UN bodies, the ILO and IOM. While serving as the most instrumental and resourceful agents of multilateral governance, the two UN bodies have developed an uneasy relationship, quoting Piper and Foley, especially when approaching undocumented workers. Although conventions and their protocols are quite comprehensive, the implementation has been very weak. The UN established an ILO supervisory body called Committee of Experts on the Application of Conventions and Recommendation, or CEACR, to monitor the implementation of such conventions. On the issue of the cost and fees for recruitment and placement, CEACR found that in many national settings, fees are played out by the migration facilitators by avoiding the term placement and recruitment and instead, as I mentioned earlier, changed with another term. And there's also the issue regarding with uneasy relationship between the two organizations, the UN bodies, which leads to implementation deficiency of ILO standard. We can explore that if you want it in the discussion. Yes.
Okay, I was going to say there's 2 minutes left, but we're already at
okay. Yes, we are already in the last slide. So this research concludes that the preference for a temporary migration regime and the rising narrative of migrant workers protection has made it difficult to limit the role of intermediaries, which is why migration costs has become high. Besides that, we also have several recommendations. First, I think from the grassroots level, civil society groups must intervene at the grassroots level to communicate and cooperate with private sectors and the government and local government to formulate recruitment procedures that respect the human rights of the job seekers and their family. And secondly, in national level, governments in both sending and receiving countries should clearly define the terms and conditions with regards not only to overseas employment, but also intermediary or facilitation process. Another recommendation at the national level is that the government must work together with the private sector in guaranteeing the rights of migrants during their laboring. This is necessary because recruitment costs and fees are, in the context of the two regions, Southeast and East Asia, very hard to completely eliminate with the existing temporary migration regime. Thirdly, at the international level, information regarding employment and procedures should be made public. Hence, job seekers could comprehend their process of recruitment and placement before they decide to apply for job posts. This intervention is possible by improved meaningful participation of migrant workers and with the use of technology. Next to that, organizations such as ASEAN, its extended composition and dialogue partners, or even external parties should conduct a periodic review on the practices of migrant workers recruitment in every member state. The result of this review shall be made public and used as a basis for governments, employers, and potential job seekers to make migration decisions. Lastly, next to periodic review, it's also recommended to establish transnational monitoring regime, focusing on the due diligence of migration industry. This monitoring should be run by an independent social auditors, which could comprise a member of tripartite actors. So I'm closing the presentation here. So I'm giving back to the moderator, Ms. Satinaya. Thank you very much.
Thank you so much, Yuda. That was a great sprint, by the way. Thank you so much for shining light on the gaps or other inconsistencies in processes and economic costs in the recruitment system, and also very clearly laying out recommendations across all levels. I would like to now congratulate both Adeline, Yuda, as well as BBC, because this marks the official launch of these two insightful and extremely very, very rich reports on the lived realities of migrant workers and the constraints and violations of rights that they are subject to in the process of recruitment and migration, as well as their protection in the destination countries. The two publications can be found in our chat box for all of you to access, peruse, and share. And we also ask that you share this with everyone you know in your academic, research, professional networks. You know, it's good information that could help workers, organizations, as well as policymakers. You know, they may even learn from it and employ it in advocacy and policymaking. Now we move on to our awaited policy discussion session. I am very pleased to share with all of you a little bit more about our discussants here today. Let me very briefly introduce them before I call upon them to share their insights. We have with us Charan Esbal, who is a lecturer in development studies at Universitas Kristen Satya Wacana, Salatiga. He has previously held positions at Universitas Catholic Parayangan, Universitas Bina Nusantara, and University of Western Australia. His research interests broadly lie in the areas of politics, governance, and development in Southeast Asia. Then we have Joanna Concepcion, who is the chairperson of Migrante International, a global alliance of Filipino migrant organizations in 24 countries. Born and raised in the Philippines, and having lived in the US for almost 2 decades, she serves now as the former executive director of the Filipino Migrant Center in Southern California. She is currently based in the Philippines. We also have with us Reiko Harima, who is the regional coordinator of the Mekong Migration Network and the executive director of the Asian Migrant Center. In 1999, she joined the Asian Migrant Center as a research coordinator and was the coordinator of AMC's collaborative research on migration in Mekong in 2001, and has since been coordinating the MMN joint activities in the areas of research, advocacy, capacity building, and networking. Finally, we have Fajar Santowadi, who is an Indonesian, a registered counselor in Malaysia, and he is the counselor cum project manager of Tenaga Nita. He has been working with Tenaga Nita since 2013 and focuses on migrant workers' rights, protection, refugee rights protection, research, as well as assisting survivors of gender-based violence, especially amongst the refugee community. This is an extremely interesting panel of discussants who are both from sending and receiving countries and have expertise in various areas. And I'm very happy to note also we'll be able to provide a gender perspective, which is often overlooked. I would like to firstly invite Dr. Charan to respond to the presentations from the reports we just launched. The floor is yours, Charan.
Thank you, Abhinaya. Thank you also to Adeline and Yuda for 2 very excellent reports and 2 very good presentations. I'll try to keep my points short and succinct here. Both of these reports raise very important points regarding recruitment and access to healthcare. The recommendations that are given, that are produced, are also very good. Some of them will need a bit of tweaking or adjustment, but they are largely, at least in my opinion, moving towards what is currently needed, particularly, in the era of the pandemic. Even though both reports are very different, they generally, I think, point towards more very common structural asymmetries that migrant workers face, particularly when they are abroad. Both reports, in a way, indicate clear structural asymmetries that impede migrant workers' access to healthcare and also legal protection in recruitment. Very often we see that governments may sometimes be, amenable or willing to expand coverage or to increase regulation, but very often, access and enforcement will still be a problem if structural impediments remain. These structural impediments include things like occupational mobility, deportability, which means that migrant workers can be sent back unilaterally at any time, regardless of the length of the contract or how much debt they have accumulated. The lack of access to legal and political rights, and also very limited channels for political mobilization. Now, if you put gender into over that, then the whole the issue of powerlessness becomes compounded even further, especially when you consider how women are actually engaged in reproductive labor as part, as migrants, the outsourcing of reproductive labor. At the same time, we see that border regimes and aspects of regulation, particularly in recipient states, and that's probably my emphasis today, actually enforce these aspects of powerlessness. Now, again, as Yuda mentioned earlier, as governments seek to increase protections, the cost of migration has increased as a result. It may sound surprising, but it should not be surprising. Very often, as Yuda has shown in the report, the enactment of new processes and measures incurs additional costs, creates new procedures, and incurs additional costs to various stakeholders. And very often these costs are then transferred onto migrant workers. And this happens precisely because migrant workers are the most structurally disempowered or vulnerable or precarious stakeholders within these migration dynamics. Now, previously, before the pandemic, it has already been common for employers and recruiters to pass on business and recruitment costs onto migrant workers, very often in the form of kickbacks, high recruitment fees, and also wage theft. And some of these are already also noted in Adeline's healthcare report. Now, many governments of recipient states avoid intervening in recruitment process because they claim that these transactions happen outside the national jurisdiction. Now, it is actually very likely, and again, I'm saying likely because we haven't had enough research on it, and this is sort of the point I'm trying to make. It's actually very likely that the money chain, which starts from sending countries, often finds its way. The money often finds its way into recipient states, and we certainly need more research to be done on how recruiters, employers, and governments actually financially benefit from these, money chains which originate from sending states and then find their way into recipient states. So I guess the point that I'm trying to make here is that a lot of the fees that migrant workers pay in terms of recruitment actually finds its way into the recipient states as well, and more research needs to be done to, in a way, trace the money. It's quite a challenging thing to do, but this is something that needs to be done to maybe even demonstrate to governments or recipient states that a lot of money is actually ending up in their society, and recruitment is not something that they can wash their hands off. A few other minor points before I touch a bit more on the pandemic more specifically. It's something to do with Indonesia, that even though Yuda and I are in different time zones, I think the azan is happening at the same time. But a few minor points to add regarding both the reports. I guess I want to, maybe caution a little bit when it comes to bilateral and multilateral dialogues. Yes, they're important, but I guess the general point that I want to make is that especially bilateral dialogues and sometimes even multilateral dialogues, depending on which ones, more often than not, and I say this in the most general way, these dialogues are largely focused on deployment rather than protection. So governments, we see, are largely accommodative to the extent that expansions and deployments serve, certain economic or political interests of elite groups, but very often the health and the economic well-being of migrant workers is not at the forefront of these forums and dialogues. Now, certainly it needs to be foregrounded. So we need to be cautious, but we also need to sort of understand what the challenges at hand to actually increasingly foreground protection when it comes to in the context of bilateral and especially multilateral dialogues. A very interesting point that Adeline mentioned earlier. Give me a second to just Got to close the window. A really interesting point that Adeline mentioned earlier was the whole idea of reciprocity, or the portability or transportability of health rights across borders. Now that's a very very interesting and innovative proposition. The issue of the portability of health coverage is something that's actually a bit more discussed between developed countries in the West, but I think we need to start researching or start doing a feasibility study on the portability of health coverage across borders within within Southeast and East Asia, right? There are probably a lot of considerations that need to be made, and there may be a bit of unwillingness on the side of either recipient or sending governments. Governments of sending and recipient states, but I think a great way to sort of kick off the discussion, to put it sort of keep it as an agenda on the table, is to probably maybe initiate a feasibility study. And I apologize if a feasibility study for Southeast Asia has already been done, so I apologize for my ignorance if a feasibility study already has been done. I'm definitely not an expert when it comes to the portability of health coverage across borders, but it's something that I think should be explored and looked at in more detail, and it's something that should be pushed forward as an agenda, maybe a little bit more within bilateral and multilateral dialogues. And I guess finally, I just want to talk about some impacts of some broader, more general impacts of the pandemics that maybe were a little bit outside the scope of both these reports, but are somehow also relevant to these issues, particularly when it comes to recruitment, but also access to healthcare as well. Now, at the start of the pandemic, there's been considerable repatriation of migrant workers from the Gulf states, to some extent in Singapore and Malaysia, but not as large as the Gulf states. And I think what we can sort of expect as a result when it comes to to sending countries is that I guess desperation, for lack of a better word, is a bit on the rise when it comes to the kind of pressing economic issues, especially when we look at the shortfalls in social welfare provisions in sending countries. Now, for a number of non-COVID reasons, the Gulf states may not be hiring on the same scale as before. On one hand, we see a shift towards renewable energy. The US has become a net oil exporter because it's not consuming as much as it uses. The Gulf states, especially Saudi Arabia, are increasingly trying to absorb unemployed local youths into the labor force. So the increased demand for overseas employment from sending countries may be increasingly directed towards Singapore and Malaysia, and maybe even other parts of East Asia, beyond South Korea and Japan, also possibly Hong Kong and Taiwan as well. And this in itself could possibly see the rise of recruitment fees. Now, within recipient states, how long quarantine requirements will remain is a bit of an unknown. Maybe they will be removed in a short while, but I can't guess that. But there are already signs that if you look at Singapore, where I'm originally from, we actually see that increasingly incoming migrant workers into Singapore are being made to absorb quarantine costs of anywhere between 2,000 to 6,000 Singapore dollars. All right. So if these quarantine requirements become increasingly institutionalized because of the structural asymmetries that frame migration, we would expect to see a spike in recruitment costs and an increase in debt burden on migrant workers, as the cost of bringing migrants into recipient states is actually shifted onto migrant workers. And this is something that we can and should reasonably expect, and it's something that we need to be ready for once it happens. The final issue I guess I want to touch on is one of access. During the pandemic, it's been very difficult for migrant workers to connect with direct services provided by NGOs, let alone healthcare services that there have already been structural impediments towards them accessing. So because of the pandemic, vulnerability is definitely compounded. It's also become very difficult for migrant workers to connect with one another and to start to collectively mobilize. So the pandemic actually compounds the kind of structural asymmetries, the kind of structural vulnerabilities that migrant workers face, the kind of structural weaknesses when it comes to power relations that migrant workers face, and it's actually really important to be to be very cognizant of these types of issues that are facing them, because migrant workers are not going to be protected in recruitment even if governments like Indonesia increase the number of procedures that may be there with the intention to safeguard the well-being of migrant workers, because the cost of doing all that is increasingly going to be transferred to migrant workers, because business and recruitment costs have always already been transferred onto migrant workers in many different ways. I mean, that's what very often what recruitment fees pay for, but not just recruitment fees, but also things like wage theft, deductions, illegal deductions, sometimes even legal deductions being made to the wages and all that. Now, as a closing point, if I've got maybe another minute left, I want to touch on a just very quick point on the issue of governments and ambivalence and ambiguity. I think I just want to be really clear. Governments are, very often beholden to a very narrow range of elite interests with very little democratic accountability, and in fact, even less when it comes to facing migrant workers. It actually took quite a number of public tragedies and many decades of NGO lobbying for a lot of these issues to actually reach the policy agenda, and even then we see governments are very reluctant to do more. And this is not ambivalence. This is a lack of responsiveness towards the problems that one of the most marginal groups within our societies face, because this group very often lacks the ability to effectively mobilize and scale up due to the lack of broader public support for their cause as well. And this is what this is why we're here, and we should remember why we're here. We need to often facilitate the scaling up of advocacy. So I think a lot of things that CSOs can do needs to go across several scales whenever possible. And I think, Sasakawa Peace Foundation, BBC, High Edwege Human Rights Working Group has always, from the time I've met them, always attempted to facilitate this type of scaling up, to find common grounds and agendas across, civil society groups across the region, and to find leverage at different scales of governance. So I think with that, I would like to end my short spiel here and give more time to the rest of the speakers. Thank you.
Thank you so much, Charan. I do have to remind the other speakers that we only have 10 minutes, and I really apologize if I yell. I'm beholden to a rigid time structure. Can we please have Joanna? Would you like to chip in, share some reflections on the finding?
Yes, thank you, Abinaya. Thank you to Daniel, BBC, and the organizers again of the event for inviting us to share our insights on the topic. I would like to focus actually more on the access to health protection, and social protection. I wanted to give input to the placement piece, but I will take too long. So to start, in our organization, we have been part of our campaign even before the pandemic, and also especially during the pandemic. Our organization has been critical of the privatization of what we're seeing, the privatization of social protection and welfare protection of migrants. And I think Sharan has spoken a lot about it already, and I wanted to thank Sharan for some of his critical points, because that is That is what we have seen throughout decades. No? And in the context of the Philippines, this is why the privatization of social protection and welfare protection, this is why we have seen thousands of migrant workers neglected during the pandemic. So in terms of access to health protection, we have seen in the context of the Philippines, we have seen 500,000 or more migrant workers have been displaced during the pandemic and were forced to be repatriated back to the Philippines. And this may be an undercount. And given that almost 3 million Filipino migrant workers leave the country every single year, no, leave the Philippines every single year. This really is a crisis. This became a crisis of massive displacement. And in terms of the health conditions of migrant workers, we have seen problems, not only health problems, that not only resulted from the loss of livelihood, economic security, but also the anti-migrant policies in the host countries, discriminatory policies, and also the government neglect. So the health issues faced by migrant workers are a combination of what they faced during the pandemic because of the loss of livelihood, but also even more so the government neglect both of the sending and the host countries. Now we have seen many of our sea-based migrant workers who have been stranded in ships. We have supported them and campaigned for them. They did not have access to clean drinking water and access to food supply. We have seen construction workers, migrant workers scavenging for food in garbage bins because they do not have any more savings or wages to pay for food. We've seen now domestic workers in Hong Kong, migrant domestic workers sleeping in public parks or outside of hospitals because their employers have terminated them because they tested positive for COVID or have just abandoned them with no access to hospitals or clinics. We have seen migrant workers who have faced mental health emergencies or depression because of the slow repatriation assistance from the government, compounded by, of course, the loss of livelihood. Now, these are just some examples of subsectors of our migrant workers who face health problems. Now, the input we'd like to give is that where is the government, particularly the Philippine government, in all of this, in its role? How does it see its role in providing access to healthcare? So, there are three types of, I guess you can say, access for migrant workers to healthcare in the Philippine context. However, these three types of access is a burden, more of a burden in terms of paying for this health access, more of a burden for the migrant workers themselves. And these three types of access, one, there is what is called the Overseas Workers Welfare Administration, so OWA for short. This is the main government agency mandated for the welfare of overseas migrant workers. Now, every migrant worker who gets deployed overseas, it is mandatory for them to pay a $25 fee for every 2 year of their contract. No, so after their 2-year contract ends, they would need to pay again, and this fee would cover and give them access to benefits such as medical assistance, such as repatriation assistance. So this is a membership based only access to healthcare, and migrant workers must pay this in order to begin their work contracts. So that is the first one. That is from the pockets of the migrant workers. The second is called PhilHealth Insurance. This is a government corporation insurance system and program. And the Philippine government recently mandated that migrant workers, it is mandatory for them to be pay monthly, or annually into this system, or else they would not be issued an employment certificate to work overseas. And this, the computation of how much they would pay for access to this health insurance would be based on their contracts, would be based on how much they would be paid overseas. So again, this is a burden to migrant workers. And it is also redundant because they would not be able to access this health coverage while overseas. It is only when they return to the Philippines. Third, and lastly, is a compulsory insurance coverage. It is mandatory that recruitment agencies, manning agencies for seafarers, and employers would pay insurance coverage for every migrant worker that they deploy. But in practice, we have seen that it is eventually charged to the migrant workers as in the form of deduction in their salaries. So it's still the private recruitment agencies and manning agencies who are responsible, and the insurance coverage would cover things such as medical repatriation, injuries, and deaths or accidents while working overseas. So all these three that I've mentioned have some level of coverage that migrant workers need in the event that they are sick or they encounter health issues or emergencies while overseas, or when they are repatriated back to the Philippines. However, these three that I mentioned, again, burden to additional fees for migrant workers. And so these are all what we see as forms of privatization of healthcare access. But in practice, it is very difficult for migrant workers to get access to this, and we saw this during the pandemic. And where is the government, our government, in all this? Because they do not have to pay. There's no cost to them in all of these three schemes, except maybe for the operations already. But in terms of government resources to actually provide additional resources for our migrant workers, it's very little. If you analyze the national government budget of the Philippines. So in terms of the government responsibility and accountability, there is only a very small fund each year allotted for assistance to nationals overseas that would pay for things like temporary shelter, food, water, and other basic needs. And this is in practice, this was not really sustained. It may be given once, but because migrant workers were stranded overseas for many months, even up to a year, it was very difficult for them to access these funds from the government. And temporary shelters, the Philippine government has a fund for temporary shelters. However, this is very limiting and only covers most of the temporary shelters of the Philippine government are located in the Middle East and Gulf region, and very few in Asia and the Pacific region. And so even if there are significant number of temporary migrant workers in the Asia region. So again, in comparison to what the migrant workers shell out of their pocket, is so much more the resources that the Philippine government allots for temporary shelter, for medical assistance, welfare assistance such as food, water, and access, and health supplies. In relative to what is passed on, what responsibility and accountability is passed on more to the private recruitment agencies and manning agencies for sea-based migrant workers. But even then, that really became a crisis when agencies themselves, private agencies, abandoned this areas, abandon the land these migrant workers. No? So the Philippine government is just left to regulate these agencies, but when they are abandoned the migrant workers, the enforcement is so weak, and the funds is not there. So I would just like to end that the three types of healthcare access that are privatized would leave out undocumented migrant workers, would leave out those who are do not have money to pay as members. They would leave out those who migrant workers who are suddenly terminated for no reason or illegally terminated by their by their employers, because the health coverage, this private health coverage would only be in terms of if there's employment contract is active, and this would leave those who are migrant workers who are stranded, and in the process of being stranded, their contract ended. So then you can see it leaves out it will leave out thousands of migrant workers. And so our call in our organization continues to be no to privatization. This is a neoliberal policy, not just implemented in many governments, countries of migrant workers, implementing such policies of privatization of social and welfare protection. And we demand for more government accountability, more government resources, that they should be the primary drivers and primary accountable to giving social services and welfare services for our migrant workers. Thank you.
Thank you, Joanna. Thank you so much. Can I have, Reiko, would you be keen on sharing some reflections and thoughts?
Sure. Yeah. I think I would, in a way, have a mixture of a reflection on the report itself, as well as probably some suggested sort of advocacy points combined. And just to set the context, I'll quickly introduce what we do. So as a Mekong Migration Network, we're the sub-regional network of civil society organizations protecting and promoting rights of migrant workers in Mekong. So in terms of migration corridor, we have been traditionally focusing on migration within the Mekong, so including Cambodia to Thailand, which was part of the research scope for the, I think, both the research. And but more recently, because of the growing trend of the labor migration from Mekong countries to Japan, so we have been the past 5-6 years working quite intensely on the issues of migration from Vietnam, Cambodia, and Myanmar to Japan as well. So that's the context in which we work. And also for the advocacy work, we focus both on the advocacy with countries of destination in terms of the improvement of policy, as well as the better enforcement of policies and disseminating information to migrants, and the capacity building of civil society organization, providing those support to migrants. But also we have a heavy focus on promoting better, in a way, role of countries of origin to be played by the governments, as well as recruitment agencies and other stakeholders of countries of origin. So that include regulating recruitment agencies, setting up accessible and safe migration channel, negotiating with the countries of destination for better treatment of migrant workers, portability of social security, better services by the embassies and labor attaché, and services support upon return and so on. So that's what we do. And so I would like to comment first from on the first presentation and the research paper on the focusing on health. So I just go by bullet point in a way. First of all, touching upon the women migrant reproductive rights, I thought it's, all this great, and I mean, sorry, great sounds bad, but, all this sort of good comparison and interesting, comparison looking at the destination country of Thailand, Japan, and Malaysia, because the problems rise at sort of different level. Malaysia is the country that bans basically migrants getting pregnant. They have a regular health check, and if you basically getting pregnant is like having a communicable diseases, you'll be deported, right? I mean, it's absolutely unacceptable policy. Whereas Thailand and Japan, at least at the policy level, they do protect women's right, reproductive rights, and they're covered by the maternity protection. So it's actually the implementation level that we are looking at. So I think it's good to, compare and then sort of be very clear. I think it's difficult when we sort of try to combine the analysis as a regional overview sometimes, but I think it's very important that we're clear on what we are exactly talking about. So when we say migrant women don't have access, or their reproductive rights are not protected, we would need to be discussing, especially when we are doing advocacy, is that eligibility, is at the policy level that we are advocating, or enforcement level. At the even enforcement level, I think we have different levels of enforcement, either that the employers are not following the regulation and the governments are not enforcing, they're not monitoring, they're not punishing the employers who violate the law, or that the employers are trying their best to actually follow the rules. But recruitment agencies are informing migrant workers otherwise. That's quite often the case of migrants going to Japan from Vietnam, that the employers, Japanese embassy in Hanoi, they're all trying to circulate the information about migrant women's rights, but it's recruitment agency who are informing the migrants before departure that if they get pregnant, they must come back, they will be sent back. So that's enforcement level at the different sort of targeting different people in a way. And or is the information dissemination. Sometimes migrant, for the case of Vietnamese migrants going to Japan, because of recruitment agencies giving wrong information to migrant women, they misunderstand, they're fed with the wrong information that if they get pregnant, they're going to lose job, they're going to be sent back. So, there have been high profile cases of, for example, migrant women abandoning their babies and so on. So that's, is that something, we can counter by providing accurate information to migrants? So we need to think about that. Or is it the quality of service that we're talking about? Because some of the issues that were, I think, identified were about like language barriers or not good service, basically by the health professional at the hospital. So then it's about the service itself. So we would need to be clear on what level we're talking about. So that's more on, advocacy strategy way, I guess. Point two, this was just out of my interest, but I think there was one slide about the Japanese employers not paying health insurance. In our study, we haven't come across with any case where the employers are not paying health insurance. There are cases of migrants who do not have official employers anymore, who have become overstayers and therefore not officially covered by health insurance. So I thought it would be sort of good to elaborate on the case. But if there are cases of employers not paying health insurance, I mean, we would like to know, and that would be great to know the statistics as well. Point three, this sort of relates to the, one of the recommendations that was about the transportability of health rights. I was very interested in sort of trying to understand what it exactly means. Because I think portability of social security is, high on agenda in the ASEAN countries as well as the Mekong countries, because in 2019, Cambodia CLMTB, so Cambodia, Laos, Myanmar, Thailand, Vietnam, that 5 countries labor summit, they came up with an agreement that they're going to work together on the portability of social security system for migrant workers. And it's on the agenda for the ASEAN. I'm sure Afandi knows better. It's on the agenda for the ASEAN discussion this year as well. So portability of social security is on the agenda, but when we say portability of health right, what do we exactly like mean? So does that mean then they can continue to have a health, basically services covered by the health insurance, in which case we would then at the same time need to advocate for the better sort of health service itself in the countries of origin, because last year we have done the research about migrants' decision-making during the COVID, and we did cover both migrants who decided to stay. This was, sorry, Thailand-focused research. And we did interview migrants who decided to stay in Thailand, but also we interviewed migrants who decided to return to countries of origin because of the COVID and other related, issues. And for migrants who stayed in Thailand, actually health service, better healthcare in Thailand was one of the strong sort of reason that came up that, that's why they want to stay in Thailand. They said if they go back to their countries of origin, healthcare is not, it's not up to the quality that they've got used to now. So, if they go back to their countries of origin, they don't trust that they can survive the pandemic. So they actually did decide to stay in the countries of destination. In this case, even if they have lost jobs or even if they're suffering from the much reduced income. So I think it's good to really look at the issues of healthcare in sort of both sense. So that's for the healthcare. And then the, again, other comments and also maybe a bit of advocacy things to think about for the advocacy in relation to recruitment. I have primarily just only 2 points. So one is, I think the discussion about the recruitment fee was primarily based on the understanding that all these migration corridor in Asia, the policies sort of developed and set as temporary labor migration schemes. And it definitely has been the case, and it's continues to be predominantly be the case. But since Japan now has introduced the specified skilled workers visa, it's technically, it's still they're discussing how to do the skill testing and which sectors can actually be qualified the skill for skills later on and so on. But in principle, basically, they now have opened the policy discussion to providing a pathway to permanent residency to migrants. So I was wondering if that affects any sense, either some of the analysis or sort of advocacy direction. But of course, keep in mind that the specified skilled workers visa, even though Japan had signed memorandum of cooperation with respective countries of origin, and pretty much the actual text is pretty much the same. But in each countries of origin, they have come up with their own national policies. So some countries, even though, for example, specified skilled workers visa allows direct hiring, some of the countries, including Cambodia, made it mandatory that the migrant workers still need to go through recruitment agency. So that also probably has some implication on the discussion on the recruitment fees. So that's, sorry, 2 points. So direct hiring is going to affect any discussion on about the recruitment fee, and also the other things about what was about the pathway to permanent residency. And the second point about recruitment agency, I think because when we discuss the recruitment fees, I think what we always hear is this zero recruitment fee model that has been promoted by ILO. And when we actually in November, we had discussion with various stakeholders about this in relations to migration from Vietnam and Cambodia to Japan. And because Japan, basically, I think, again, we need to look at like which level we're going to target for the advocacy, because the big companies, they have joined their sort of force together the past couple of years, coming up with a statement, coming up with some framework that they promote the recruitment fee and they're going to pay for the recruitment cost. But in the meeting, they were saying that it's hard to actually implement it because the cost structure in the countries of origin itself is not transparent. So is that cost transparency we are going to tackle, or is it the commitment of the employers on the recruitment fee that we tackle, or that but these companies who commit are big companies, but actual employers are a majority of the employers are small, medium scale enterprises who do not have extra budget to pay. So if that's the case, that we actually just had a meeting with a small scale the garment industry in Japan a couple of weeks ago, and they were saying we also need to look at the supply chain structure as to if buyers themselves of the products can actually absorb some cost instead of pressuring the producer, the suppliers to cover all this cost. So yeah, I think, sorry, I know I have run out of time. So those are just the couple of points for reflection.
Thank you so much, Reiko. Before we invite Fajar, I would just like to remind the audience that if you have any questions, you can just drop it in the chat box. If you're tuning in on BBC's YouTube page, you can drop it in the comments and one of us will pick it up. And after this, we will also be moving up audience members into the panel. And you have the choice of asking the question by yourself as an interaction with the discussants today. Fajar, the floor is yours.
Thanks, Abinaya and everyone. Let me share my screen. Yeah, so this is my response to the two reports that I hope it will add value to the reports, hopefully. Then I would start with looking at the realities from the field that I believe it's important to the reports, because I especially on the Tanisha reports on the what you call social protections, it's rather difficult for me to digest. But when I look at the fact from other sources, then it makes me look at it clearer. So I start with the realities of recruitment. The recruitment and management of blue-collar migrants have been highly costly. So that's very clear from the report. So I would like to just zoom to the actual reality in Malaysian context. So it's based on Malaysian experience. When I look at even from the workers who came from the east part of Indonesia, especially Kupang, the actual cost of recruitment come. I mean, consider transportation, levy, and all those things. My calculation will come to about 3,600 something. So that's the actual fees. But we know for a fact that there are recruitment of agencies that's charged to 15 to 18. So that's borne by employer, but also partly by the employees. So in that context, so just imagine that the amount of recruitment fees is almost 1 year of salary of, if it is take a domestic worker. So that's a huge amount. And then and why this continue existing? And I think the answer is quite clear, but it is not easy to to fight against. So there has been a facilitating labor migration has been conducted as a business and on its own as a profit driven. Even in our cases in Tenaganita, we always come across agency that play as if as an employer, but actually it's not an employer without a business infrastructure. So basically they are fake or bogus. We use that term to call them. So both modus operandi with semi-privatizations or even full privatizations, which has been taking place. So it's have cost a lot to the migrations, to migrant, especially to the migrant workers. And then what can we expect, or what can we think of as out of this? So cost of, simply to put it, so if we would suggest, so cost in terms of transparency of costing, we should focus on the flat rate that it's realistic, that we can say it's a transportation levy with the taxation, part of taxations, and then social protections. Those three are the core element that should exist, should be part of the cost. Whereas the other added cost, which is much higher than the actual cost, is part of the profit making. So that's easy to understand but difficult to find. So I read in one of the report that's Yuda provided, there is an indications of politics behind the private agencies and all those connections and cronyism, but it's not quite what you call it. I believe we should find another strong evidence for that, maybe a more clandestine research, if we may use that term. Then about the still migrant workers and recruitment and placements, I found this, or I rather propose these arguments. The high cost of migrants workers recruitment that borne by one or either both employer and employee is one of the contributing factors to the precariousness of working conditions, that includes control of movement of migrant workers, withholding passport, employers' fear of losing their investment, restrictions, communications, and other difficulties that's faced by migrant workers, including even restriction of workers' unionizations. So those, I see from observation, there's a link of that. Then high cost of recruitment and placement by workers, at least 3 months salary reductions, coupled with lack of knowledge about workers' rights and seeking redress, are two major contributors to stay in that precarious working conditions. And then the two assumptions or proposal above, is create imbalance power between employer-employee and create a toxic employment relationship that is very exploitative and more profit gained by employer and less benefits gained by the employee. Then I found, I think some might have been familiar with this. This is ILO report 2016. It's about government-to-government arrangement, particularly for Bangladesh in plantations. It's concluded that by this arrangement, costs reduced up to 10 times. So that's a huge. But the question is, why this private recruitment agency still continue to be part of a recruitment and placement of migrant workers? So the complex questions and complicated that we fight, that we are trying to fight. Then I found there are tensions in the recruitment and placement of migrant workers. There are three corner fight or tensions. Which is the first corner will be a high cost or more profit for middle brokers, the profit motives versus low cost of migrant recruitment and placement that's desired by workers. And then second, tensions between safe and regular, so-called, but not necessarily. It's tied to the involvement of private recruitment and placements, and dangerous versus dangerous irregular labor migrations. And then the tension that I can see, a claim of necessity of middle broker versus the lack of capability of state to solely manage migrant labor, recruitment and placement, which I suspect is more of an excuse or expressions of lack of commitment and also desire to gain profit of certain part within the state apparatus. Then the interesting case of Made Online, is the example of the tension that I mentioned. And in Malaysian context, between Malaysia and Indonesia, this is actually what you call it, unilateral decision from Malaysian side, which very much opposed by the Indonesian side. Even if we look at the alternative proposed in the MOU that's being processed, one channel systems, I will still see the arrangements still involve private players. So again, it is the desire to always making it private with a profit motive is still always stay there. Then I propose this, which also probably some of it reflected in Yuda's report, the circumstances that necessitate the private recruitment agency, so-called necessitated, but I think we should look at it critically. I would start at the bottom here, beyond all this technical and pragmatic challenge above that I would mention later, there is a fundamental lack of political in the country of origin and destinations to operate migrant labor management free from profit. So we should find more. I mean, we should be able to find more evidence on the ground if we do more clandestine kind of research. Then this is the basics reasons, but there are other pragmatic and technicalities that probably can be used or has been used and excuses. First is geographical location and spread of the population, and then unavailability or lack of information technology infrastructure that support integrated data management of recruitment and placement of migrant workers, and coupled with unpreparedness of populations in IT or internet usage to reduce dependency to facilitations of private agencies. So recruitment placement process remain concentrated at the capital or big cities, but there has been efforts actually to decentralize to the not to the center or big city, but I don't think it's a success. I have not personally seen this as a success, or rather the success is not so significant or not visible. Then there is always symbiotic relationship between private recruitment agency and state bodies that's slightly indicated in Yuda's report. Okay, and I have a little bit of notes on the clandestine migrations routes that's also touched by Yuda. That's continue existing. If we look at the recent incidents of both, that interestingly, we had a comment privately said by Indonesian diplomatic missions that every state know for a fact that this is happening, and then but the difference now is it is known more openly now because there is a so-called efforts to enforce. So yeah, this is just to say that this is one of the contributing factors to the precariousness of the labor migration. And I think this I will skip this, but I think Yuda and especially Yuda may look at it privately for the interest of time. And then still continue the notes on the temporariness of the blue collar labor migrations. So this actually manifests in the othering of lower paid migrant workers that appear in many places. First, nationalism, which is narrow, or in other words, xenophobia, that we feel very strongly, especially getting more stronger even during COVID pandemic. And then local workers versus migrant workers, they put into fighting modes even within unions. And then different policy applied to blue collars and white collars in Malaysian context. They have different right or entitled to them. Then migrant labor management through national security lenses of country of destinations, which usually it's commonly known that Malaysian immigration law supersede the workers' status as worker and their rights. Then other phase of this othering is the infringements of human rights, which we face on the daily basis in Tenaga Nita. Still continue on the notes of temporariness.
Sorry, I just want to remind you have a minute or so left.
Yeah, okay, thanks. So this provide more benefits to to employer than to the workers and also to the state, rather than protecting rather than the workers. So I would touch on the social protections now as connected to the temporariness. The lack of the social protections or the issue that's surrounding social protection also connected to the temporariness, where I think the most important thing that needs to be highlighted is that from the field I sense skepticisms among the workers about the benefits that is provided by these social protections exist from the source country and also from the destination country. So we need to, I think we need to pay attention to that, and especially to learn further what's the workers from the workers' point of view, where we can propose something more doable in future. Then I would jump to actually in Malaysia, Singapore, Indonesia, there has been this scheme that is proposed and even implemented. But then looking at the protections provided, actually it kind of, if they can access, it kind of benefits the workers. But the issue is that the workers lack of information, lack of awareness, lack of skills or technicalities to be able to access that. And adding on to that, another issue is the undocumented status, of which in Malaysia is the biggest issue, which excuse me, sorry, biggest issue that make the social protections that's available doesn't work or as it is intended to. Okay, I think I will end that. So this what you call written response I would provide. So I hope that will give you added value to the reports. Thank you.
Thank you so much, Fajar. I'm sorry about having to cut you off. I hope maybe if you can share the presentation with us, everybody can refer to it. So before we go into our Q&A session, I would like to remind our audience that you will now be moved to panelists for the session. So there'll be an invitation sent from the team and you just have to accept it. And this is so that you may ask your questions directly, or if you feel more comfortable, you can drop the questions in the chat box and we will present it to the speakers. If you are watching this via live stream on BBC's YouTube channel, you can just add it in the comments. Now to the exciting part. I would also like to, Adeline and Yuda, if you'd like, if within the panel itself, if you have questions for each other, please feel free to just, ask each other or prompt each other. I want to, as we're adding on the audience members into the panel, I just want to acknowledge what Fajar had mentioned in his presentation when he spoke about how different countries know the barriers to the migrant policies or immigration policies. And I wonder if, and this question is directed to everyone on our panel today, would commitment to and ratification of global obligations to international standards, for example, through ILO conventions, motivate the governments to review national policies and immigration policies that are already in place? I open the floor to anyone who'd like to take that question. No one? Charan, Fajar, maybe Yuda, what about the impact that the ILO conventions or international policy, international commitments could have?
Yes, thank you. Maybe I'll just jump in to give you a quick answer for that. I think based on what I found as well in the paper, it was quite clear that the ILO has been working very hard to develop the standards for all, especially with regards to the placement and recruitment fees. But the fact that countries tries to, avoid the terms that are very specifically related to boosting the cost, soaring the cost of recruitment and placement. I think that's also quite central in the findings, which makes us all very difficult to manage, because I think ILO is based on clause. Basically, they're just basically addressing on a strict definition, but when it comes to the ground, and then people or the private recruitment agencies, they started to propose something else, which are considered as not part of recruitment, but is central in the process of going through the process of departure. So I think it's, although they have ratified all these measures, I'm afraid they will still find ways to navigate against, all these strict protocols. But then, yeah, so that's why in my proposal, I also recommend that we should establish a third-party independent social auditors that can basically inspect every steps of recruitment from the beginning, from the home countries up to the host country, which can always try to trace, as Charan said, that money always finds a way to coming back to migrants. I think that's also one of the ways that we can try to scale up into a more serious institution. I think that's from me.
Thanks.
Sorry. Yeah, I think my comment of that questions may be sounding similar to you, but I'm more distrust towards the international, what you call it, not to disregard that there is a benefits, but the actual reality on the field has always relied to the local regulations that's created. That's quite often we see the gaps between local law and the ideals proposed by ILO. So, but in that sense, the routes to the improvement of that local law has been so daunting and challenging. I think everyone in Malaysia, especially, would feel that to change the term of domestic employee to domestic worker, that has been took long process. That's very minimum change that's happened, which we on the ground are very much disappointed with on this small change. So again, the key to me is a commitment of the state, and then maybe highlighting the comments that I want to highlight previously about. I'm not sure if this is a utopia. That's to shift from making the recruitment and placements as a business to the public service, as a public service that's supposed to be done by the states, to what you call it, to ensure the livelihood of the biggest populations. It's in a better situation. So yeah, that's my comments. Thanks.
Just a quick additional point. Agree with Mas Yuda and Pak Fajar. But when it comes to the question of will signing these conventions or treaties help? Not really, but at the same time, it will allow civil society groups a bit more leverage to add a bit more pressure on states. So yeah, that's all I want to add.
Thank you so much. I was also just wondering, what are some of the main, and I think perhaps Reiko and Joanna, you could take this question, but what are some of the main barriers or deterrent factors that stop policymakers from extending social protection to migrant workers? Because I realize that, in your advocacy, Reiko, in particular, there has been some successes. Same with Joanna as well, but I think the barriers are a bit higher for Filipino workers. So I'm just wondering what some of these barriers are, and if we could move into knowledge sharing within the region.
Maybe I'll focus on Thailand in this context first, because In terms of social security, because including Thai workers, if you are employed in what's considered as informal sectors, they are not eligible. So that's at the moment limitation and problem for many migrant workers who do register or who are documented but work in informal sectors. Same as Thai co-workers, they cannot be part of social security system. And instead, Thai government has legislated this sort of similar, not similar, less comprehensive, but separate sort of health insurance for migrant workers. So that's been covering migrant workers. But I think in a way, so that's about the social security systems setting itself is a bit limiting. But also in case of Thailand, you know, there are 4 million migrant workers, and still, I mean, there have been increasing number of registered migrants or regular migrant workers, but still large number, this estimate vary, but you know, roughly half of them are still undocumented. So for undocumented migrants to be part of social security system or the migrant health insurance, that's been difficult. I mean, we've been trying to advocate with the government for like migrant, you know, sort of modifying the system where migrant workers can be part of social security system through employers without having to prove that they have documented immigration status. But that has not been going anywhere very much. Yeah, so I think that's the nature of the migrant status, as well as the social security system, Sarah. And also, of course, another issue of the healthcare system in itself, right? Because if you are working or living in a country like UK or Hong Kong that has the government, you know, national healthcare system where the healthcare itself is technically free, especially for the emergency cases and so on, then it's not necessarily contribution based that you can make, you know, have free access to certain healthcare. But in many other destination countries that we are talking about, it's not the government, you know, healthcare system itself is not automatically free. So I think we need to look at the several different levels of challenge.
Thank you, Reiko. That's very pertinent point, actually. Joanna, I'm wondering if you wanted to share some thoughts with us, or maybe Adeline as well.
Binaya, I think this goes back to, hello? Okay, great. I saw Daniel's hand. I think this goes back to sort of my main argument earlier. And this is why we've been really trying to aggressively oppose any forms of privatization in terms of migration policies. I would like to share that, and this also related, Abinay, to your question earlier in terms of conventions, because the Philippines is a signatory to the Convention on Protection of Migrant Workers and Families and has ratified this, and has also been a champion country, including Indonesia, I believe, in terms of the Global Compact on Migration. Late last year, the Philippines passed a law that would institutionalize a new department specific for migrant workers. So this is, I believe, the first of its kind, if not in Asia, maybe in other regions as well. And we have had time to really analyze the language of this act, because at the surface, it sounds very good, and it actually adopts language, human rights framework and protection, and language of social protection and welfare for migrant workers that you can find in the language of the ILO or the Global Compact on Migration. However, if you dig deeper, again, this goes back to the root problems. If you dig deeper, it still focuses on systematic and aggressive export of our of labor, no, of cheap labor. It has more language. The language of protection is there. The access to healthcare and welfare protection is there, but it's drowned, I guess you can say, by sort of the overall framework of privatizing the migration process, and more so increasing the capacity of recruitment and manning agencies in the process, more so focusing on the rights of migrant workers, whether it's to healthcare and other access to social protection. And so we see this really detrimental to migrant workers if now we have an entire department dedicated to migrant workers, and the argument is that it would help, provide easy access for migrant workers to protection. But then again, when you dig deeper, it's not in the responsibility of the primary responsibility is still not in the government or the state. It is still placed upon private recruitment agencies and manning agencies for seafarers. So again, you have this language of protection, and it sounds and we already have this language actually in our laws in the Migrant Workers Act in the Philippines of 1995. So there isn't anything new in the new law instituting the department. So and the Philippines is often looked at as a in the international migration policies, that it is looked at as a model. And so, CSOs like Migrante have really tried to provide a critical lens in who is providing these services and social protection. And what we've seen in the pandemic, the lack of government resources and accountability slowed down the process of providing access, because concretely the government would wait. If a family member or a migrant worker would ask for assistance from the government, the protocol is that they would only regulate. The government and state would only regulate. That's its role. That's what it sees its role. It would only communicate with the respective private recruitment agency or manning agency. Hey, give this migrant worker the protection they need. Where is your insurance? You repatriate them. You have the burden of the cost for all of these social protection and health access. So that is the only role that it has played. No? So it's still a problem if we do not play the actual framework of and privatization in our laws.
Thank you so much, Joanna. It's unfortunately, I think across the region, the legal reform is there, but implementation is definitely lacking. Fajar?
Yeah, sorry, I would like to respond, or maybe adding on to the issue of the social protections about addressing barrier. So I'm in the opinion that before we address a barrier at the policy level of proposing what the improvement should be made, I think at the current moment, I would prioritize addressing barrier at on the field level of among the workers. First is the understanding and the reality of migrant workers do not access the available current social protection, even though it's not perfect. But I found some research reports saying that even employer in Malaysia and also worker and also employer, they do not aware that social protection actually exists despite they paying contribute to the social protections. So that issue of understanding, knowledge, and accessing the existing social protection we should see example of success story of migrant workers getting protected. And more. I mean, that should be on the mainstream until until then, we can expect to address other improvement at the policy level. And let's not forgetting that what you call social protections would also include old age pensions for migrants, because I know for a fact that some actually it is exists but optional for migrant workers, where it's provided in the source country and also in the what you call it destination country, optional for migrants. And I'm sure, I believe that many people are not aware of this, and then migrant workers, I suspect that migrant workers see that contributions, see that as an additional burden instead of looking at the future protections. So yeah, I think I would like to address that from the ground first before we really improve the system that exists. Thank you.
Thank you so much, Fajar. Can I just quickly invite Adeline? She has to leave very shortly. So Adeline, if you have any comments or any response to the comments and reflections on your research paper, feel free to share.
Sure, thank you so much, Abhinaya, and thank you so much for all of the discussant for their response and feedback as well. It's definitely a learning lesson for me, and I guess for all of us as well. It is quite difficult, I guess, by virtue of the report itself being quite regional, in the sense that it's hard to get the on-ground focus, as highlighted in the limitations as well. That is something that is definitely needed, and I am very happy to hear sort of the work of the activists on the ground and on the grassroots working in this issue as well. And I certainly agree that the response should not be privatization. I think the issue of privatization is actually against universal healthcare coverage in its understanding, and so therefore, yes, that privatization is definitely not the way to go, and it should be part of in an ideal world, and of course we're speaking ideals here, and there isn't really one country that I could really think from the top of my head that is following this type of ideals, which is quite a shame. But in an ideal world, that it shouldn't really matter who we are and where we are, when we are, and all that when we want to go to a doctor, when we want to go to a hospital, no matter who we are, no matter what we do, we should be able to get healthcare. And I think that is the essence of the study, is that even if a person is recognized as a resident, even if they're documented, that they are still very systemic barriers that are existing for them. I think Pa Fajar, you make a very good point about working with the community, working at the grassroots level first. There is certainly a gap of knowledge, and that is definitely highlighted in COVID-19, where a lot of migrant workers misses, I guess, the information about COVID-19, information about avoiding it, information about treating or vaccination or anything like that, because information is not accessible, and the number of issues intersects with what's been discussed as well about linguistic barriers, but making sure that the migrant workers and that the employers are knowledgeable about the health rights that are already afforded is one issue. And then another is when accessing that health right, if the health system itself, or in terms of the people in the health system, don't know about those rights, it's, that's another issue, right? That if migrant workers know that they are able to go to the doctor, but that the doctor don't know whether they can treat migrant workers, or that treating them means that they don't have to pay because they're insured in one way or another, that's another issue. So while we can improve knowledge in migrant workers, which I agree is lacking. I think they coupled with that at the same time, and that this is probably in terms of prioritization, this needs to go hand in hand, is that the health system itself, in terms of their personnel, need to be knowledgeable of their access, not only in terms of the provision, but also in terms of addressing language barriers. Because if a migrant worker cannot explain their symptoms in a comfortable way, in a way that is understandable by both parties, then there is still going to be a lack in the quality of healthcare that they are afforded. So a lot of, I guess a lot of the things that are discussed are ideals, right? But a lot of it is also that things need to happen concurrently for it to really achieve what we really want for, migrant workers to be able to not only access healthcare, but have good quality healthcare as well. It is a very difficult issue, and I found that there are a lot of moving parts, and particularly during a pandemic, there are a lot of changes happening with regards to the health system and health coverage and all that. So admittedly, this report might need to be updated quite soon. I guess in a post-pandemic world, if we can call it that how our country's moving on from the responses that they have during the pandemic. So I am looking forward to any sort of offshoots research about this, because it is very dynamic and it is very interesting and it is very timely. Thank you so much for the time.
Thank you, Adeline. And you're spot on. I think that the health system and the Ministry of Health in all the countries are huge stakeholders. And right now at this point, it's really left, at least in Malaysia, it's really left to, and I'm sure across the region, left to the healthcare workers or the doctors or individual hospitals to determine if they want to treat migrant workers or undocumented persons and how they would charge them as well. So it has to be streamlined. Thank you so much, Adeline. Can I invite Yuda maybe to share some reflection on the comments he's received on his paper?
Yes, thank you very much. So first of all, of course, I'd like to thank everyone who has joined us in providing valuable inputs, and especially with regards to placement and recruitment. There are a lot of issues that have not been adequately addressed within the reports. I believe that's the case. But at least we should, I agree with Sharon again, that we should scale up all these advocacy movements, whether it is based on research-based initiative like this, or maybe more on the grassroots level, like what Pak Fajar and Joanna and also Harimasan are doing on the ground. I think we can do it simultaneously, and we do hope that these reports can be passed on to the policymakers, at least to make them aware that there are a lot of homeworks to do, and we are watching them from the ground, and we hope that this can be a way to go for the advocacy of migrant workers. I think that would be my last comment. Abhinaya, thank you.
Thank you, Yuda. I really echo that. We need to do our best to make sure this, all these reports land on policymakers' tables, right? Whether they act upon it or not we can never decide that, but it has to get there. The fact that the work is being done is important. All right, this has been a fantastic discussion. Thank you so much, everyone. But unfortunately, we have run out of time, so I have to wrap it up. Thank you, everyone who's on the panel today. And perhaps if you'd like to, if you're comfortable, you can share your contact details, just as Adeline has done. So if anybody else has burning questions, they can send you an email or they can find out more. It's been an honor to facilitate this session. With this, I'm going to hand it over to Aoife.
All right, thank you so much for all the speakers for the fruitful discussion and all the insights. Also, Ms. Abhinaya, for your hard work in facilitating our discussion. We've gotten so many new knowledges as well as more improvements on our findings regarding the issues of health protection and eliminating placement and recruitment fees among the migrant workers in the two regions. So finally, we have come to our last session, and we are going to be hearing the closing remarks from Mr. Daniel Awigra, Executive Director of Human Rights Working Group Indonesia. Mr. Daniel, the screen is yours.
Thank you, everyone, and especially thank you to Abinaya. Please give a very warmest applause to Abi, who's been fantastically led this very so much challenging, very complicated issue. We aware since the beginning that this is not an easy task for her, but she's, of course, she's in commemorating the International Women's Day. Women's really leading in this particular agenda. We all know that these two issues has been the most two of the most issues that really becoming the issue that migrant worker struggle for in some time. And then from the discussion, we also know that there are some specific challenges within the particular issues, as well as on the way that we have been asked to address some systematic root cause of issues, such as the regimes of cheap labor, temporary status of migrant worker, and so on and so forth. So I think it's also an invitation to all of us to work together. We in BBC, we keep believing that using the bottom-up and multi-stakeholder as well as cross-regional advocacy has to be strengthened, basically, especially now, that there has been, in a global cooperation and solidarity to struggle together to recover from COVID pandemic. But now worlds continue to be more, like a more unsafety, deteriorating situation, human rights crisis, humanitarian crisis, because of the unilateral and undemocratic action by some leaders, just to mention Russian invade to Ukraine, but also what's happening in our neighboring Myanmar, the coup by the military. So I think by this as well, we'd like to, of course, give more attention to the broader issues of migration, not just only the issue of migrant worker, those who are undocumented, but now adding more, burden for us, challenge for us to taking care of those who are in the risk of stateless, for instance, or IDPs, internally displaced people. So I think it is a lot of work to be done, and a lot of initiative needs to be, how do you call that, to make a collaboration. So it is also again, I'd like to invite everybody here to join with this initiative to really, how to call that, voicing out the concern. It is somehow, I see, very privileged. Well, we can still discuss somehow in the Zoom like this. Well, maybe outside from us, there is somehow very challenging situation because of their setting arrangement work, but also some difficulties because of security reason. So thank you so much, everyone, for this very fruitful policy dialogue, especially the researchers, Alin and Yuda. Congratulations for all of us, as well as Pak Charan, Reiko, Joanna, Fajar, for giving a very insightful feedback, critical, but at the same time encouragement, to us to really carry further the advocacy to the policymaker. And last but not least, I'd like to thank all participants here, BBC team and HRW team, but also the FTF for the trust and support, generous support to us. Thank you, Mr. Adesisan, Fumiko Tamoto, and also Chelo Mori, who are still here. Thank you so much, and have a good afternoon. Thank you, Reiko, Pak Charan, and everyone.
Thank you, Mas Awi.
Thank you.
Thank you, everyone.
Have a good evening.
All
Bye.
right.
Thank you, Reiko. Hope to see you again.
Yep.
Bye.
Yes, you soon. Bye.